Champs. I hope you're all doing good. Guys, today we are going to talk about a very important domain which is very important for Part 3 MRCOG, which is information gathering. Obviously, all the domains are important, and probably the best way to clear these exams is to get tick boxes in all the possible domains which you are tested for. One of the easiest and good scoring domain is information gathering. Please understand there are a couple of things which can fetch you the marks, or probably which you can tick all the boxes with few tips and tricks. First thing, information gathering is definitely to ask the information from the patient. Second thing, information gathering also means the information provided to you outside, okay, through the charts. Probably it could be myostat, ultrasound, or whatever. Okay, so probably they could have given a triage document which is complete in itself, which is quite a detailed one. Okay, so and they would have told you that you will be tested on this domain. So basically what they are trying to tell you is, if the information is already given to you, you have to gather information from those triage document or the investigations, and you need to speak to the patient based on that. So one of the commonest mistake what people do is to ask the information given outside. Okay, so because they do say that they would want to cross check. Actually, it is not required. It is not required to cross check every single information, because you are fighting against the time. And what is the time frame for the information gathering you take? Okay, to ask the information from the patient, ideally the time should be by 3 minutes. Okay, it should never cross 3 minutes. Max to max 3.5 minutes, you should be done with it. Couple of stations like preconceptional counseling or the urogyne stations, it could go up to 3.5 minutes. How to cut short this information gathering? Once you have checked the patient name and age, and you have fixed an agenda, which has to be very small, and then start with the open-ended question. Can you tell me more about your problem? Can you tell me more about your pregnancy? Provided there is nothing given in the information board. And once she starts telling, remember the patient has around, the role player has around 4 pages to remember. So let her talk, and whatever she misses, you can ask. Okay, and listen actively. Do not make a mistake of asking whatever she said. Like, so if she has told that this is the first pregnancy, please do not ask, is this your first pregnancy? So she would get really irritated, and if the examiner, they would make a note of it as well. Okay, and there is a skeleton which you need to follow, but it is not necessary to ask every single thing in all the stations. Of course, you will ask the history of presenting complaints, depending upon the case, obstetric history, and the gynae history, you might have to be asking. Normally, the questions which you need to ask in all the stations is, apart from the regular history, the allergies which you need to ask because it's a patient safety, if not given, of course, the support at home, the mental health. Okay, normally I do not ask habits if somebody is in labor, because it really doesn't make sense. Family history you should sparingly ask, and do not ask for example, if somebody is in like she's come to decide the route of delivery or the mode of delivery, you won't be saying anybody with cancers. It doesn't make sense. So it has to be a targeted history which you need to be taking. Now, coming to the information on the board, there could be 10 pages. Please remember there is one master slide which talks about what is a patient name and what are the domains you are tested, and as well what is it that you have to speak to her, talk to her about management, explain the diagnosis, whatever. That's the master slide. Out of 2 minutes, even if you spend on 30 seconds, you should know what you have to be doing once you enter inside the cubicle. In the paper, in the booklet which they give you, write down in the bold letters the name, because sometimes it's difficult to remember, and also the age, and write down whether it is PST or a structured discussion. Then go through the other documents, triage documents, MEOS, or whatever the charts they have given, go through them. Do not worry, the same papers will also be on the table. Okay, so once you have gone through those documents, then probably if you want to, during the task, if you want to say, you can always tell the patient, can you give me a minute so that I can go through them? Let me go through your reports. Okay, so you feel that you have wasted 3 minutes outside, still you are not sure, you will come inside and you will talk, and in between also you can ask a permission and do. Or you enter but you feel that you want to have a look, introduce and say that, can you give me a minute before we start the consultation? I just want to have a look, okay? Whatever it is, if you signpost, it's a good idea. And coming back to the signposting, when you ask about the sexual life, sexually transmitted infections, or about the habits, it's always a good idea to signpost rather than shocking the patient. You should never be asking, are you sexually active directly? Instead of, you can always say that I'm going to ask you a couple of questions about your private life, which can help me to treat you better. Okay. Or for the habits, you can just say that we ask these questions to every other patient who comes in. So is it okay if I ask you, and do you smoke? Do you drink? Do you take alcohol? Do you take drugs for fun? Please remember, one question at a time. Let the patient answer. Do not interrupt the patient, okay? And do not keep it like a rapid fire. Yes, no, yes, no. It should be a smooth conversation which you guys do, okay? These are the couple of tips which can help you to do your information gathering. Everything can be done with a rigorous practice. When you are doing your stations, keep a 3 minutes timer and try to practice only information gathering. Initially, people, when they kickstart the preparation, they always feel part 3 is difficult, but to be very honest, especially the information gathering, but to be very honest, I have heard very few people who have a problem with the timing of the domain. All the very best. Believe in yourself and you'll be able to do it. God bless, guys.